Aloha, and welcome to this presentation of the Vegan Society of Hawaii. We are so happy today to welcome Dr. Scott Harrington. Aloha, Dr. Harrington.
Hi, everyone. I'm so happy to be here with the Vegan Society of Hawaii. This is amazing. I'm so happy. I'm Dr. Scott Harrington, and we are going to talk about bowel health, the scoop on poop, unleash your bowel's superpowers. The alternative names for this talk are Stool School, Number 2 and You, Turd Talk, and Crab Course. So we're going to joke around a little bit, but this is a very serious topic. We are going to talk about optimizing your bowel health. I'm talking about how big should your bowel movements be? How often should you have them? And about fostering a healthy microbiome. We're going to hit on constipation and diarrhea. Let's get right into it. So why should we even talk about bowel health? Bowel diseases are very common. Constipation. I just as a child, I was a very constipated child. My parents weren't vegan or vegetarian, and I was eating a lot of low fiber foods, and I was quite constipated, and even into adulthood. And so once I watched the movie Forks Over Knives and switched to a plant-based diet, my bowel health improved dramatically. It was like night and day. We've all experienced some of these things: constipation, diarrhea, but then also things like anal fissures, very common with large stool. And then over time, you can develop diverticulosis, pouches that form in the colon, or even some serious diseases like cancer or colitis of the bowels. Bowel visits are very, very common for primary care. And abdominal pain, 5 million visits. This was back in 2013, I believe. So these have probably grown substantially, but it kind of gives you an idea how hemorrhoids, diarrhea, diverticulosis, how these lay out in terms of frequency of visits. We want to optimize our bowel health. Why? Because colon cancer is very common. It's the second leading cause of cancer death when you put men and women together. The third leading cause of both sexes. We're all worried about this, and we're all interested in preventing colon cancer. 4% of men and 4.1% of women. The cool thing is that there's kind of one answer for this, and the idea is increasing your fiber intake. A high fiber diet will decrease your risk by 17% per 90 grams per day of whole grains in your diet. So that's 2 servings. But when you look at all the things that this does for you, just by increasing your fiber content, by decreasing your risk of colon cancer, it's quite powerful. Other factors that can help prevent colon cancer are increasing your fruits and vegetables, your calcium intake, folate, decreasing red meat and processed meats, alcohol, which is just a straight toxin to the GI tract, smoking, which blocks the immune system and decreases blood flow. So lots of reasons to increase cancer. And then a sedentary lifestyle, obesity, and low vitamin D. These fiber benefits. What are some of these fiber benefits? Well, it will lower your risk of colon cancer, diverticulosis, hemorrhoids, fissures. We talked about that. But those are kind of long-term thoughts. What in the short term, what is it going to help? What is fiber going to do for me? Well, it's going to help me feel full, something called the ileal break. And we're going to talk more about that during our discussion. It reduces cholesterol. So not only is it good for bowel health, it also helps prevent heart disease. Having a high fiber diet can slow the absorption of sugar and decrease the insulin requirement for you, and therefore improve your diabetes. In terms of hormonal health, having a diet rich in fiber helps to pass additional or excess estrogens through the bowels. And every 10 grams per day will decrease breast cancer risk 4%. Quicker transit time will decrease the exposure of different toxins on your colon. And also, it can help reduce gas and bloating as you're passing the stool, and having normal daily bowel movements helps avoid basically being backed up and having gas and methane gas related to stool sitting in their colon. And then lastly, we're going to talk about fiber being good for the good bacteria and talk about the microbiome, because Everyone's talking about that lately. What does the USDA recommend for fiber intake? They have an equation, 14 grams for every 1,000 calories. And for women, if you say average about 2,000 calories, that's 28 grams. And for men, 2,600 calorie diet, that would be about 36 grams. But on average, the most average Americans are getting much less than this, about half. 97% of men and about 90% of women are not reaching the goal. Why are we not reaching our fiber goals? What's the deal? Well, it might be the amount of plant-based foods, but even still, why? Well, there's this concept of processing, ultra-processed foods, and I call them frankenfoods, where you take a food that looks normal, that you can recognize, and you turn it into something that is completely unrecognizable from its natural form. Frankenfood, here we're taking corn, removing the fiber, turning it into cornmeal, or boiling it down and frying it, turning it into chips, or popping it, turning it into popcorn. The more fiber you strip from a food, the more absorbable it gets. If the particle size gets smaller and smaller, and it's not protected in a shell of fibrous, non-absorbable fiber, then carbs and the resulting sugars are easy to absorb, and it raises your blood sugar, something called the glycemic index. And this is kind of a metabolic emergency for your body. That high sugar, it scars up the vasculature, so the body has to bring that down into a normal level. Foods that are highly processed and highly absorbable raise your blood sugar. They're called the high glycemic index foods. More natural foods that have a lot of fiber are called low glycemic index. So why am I talking about glycemic index and we're talking about bowel health? Well, because we're talking about the processing of food. And this was adapted from my favorite registered dietitian, vegan dietitian, Dr. Brenda Davis. On her website, she has something called the whole grain hierarchy, and she puts things in order of processing. And I have adapted that here where we talk about the whole grains at the top. They have the lowest glycemic index, 50 to 55 on the glycemic index is low, or 100 is pure table sugar. And then as you go down this stepwise path, you'll see more processing. So steel cut oats are just cut in half or into multiple pieces. Then you have rolled oats, shredded wheat, shredded grains turned into flour, these kind of things. The particle size is getting smaller and smaller. And then you just see how the glycemic index gets higher and higher, closer to table sugar, more easily absorbed. And then down at the very bottom are those flake cereals. When you used to hear about don't eat a candy bar because it will raise your blood sugar and then you'll have a blood sugar crash. Well, same kind of thing with various cereals and rice cakes and popcorn and stuff. You can have a sugar spike and then a crash. All right, I think it's time for a poop break. I don't know about you, but I think we have to take a little pause and talk about the Squatty Potty. Okay, do you need to have a Squatty Potty? Turns out you don't necessarily need to have a Squatty Potty. I mean, they're kind of nice to have this device in your house, but you can just assume the thinker position. You can just kind of fold your body in half and lean forward, and that increases the angle where the stool will come out more easily. Poop break number 1 of 4, no need for a Squatty Potty, just assume the thinker position. I told you that we would talk about optimizing bowel health. How do you have the perfect bowel movement? The perfect bowel movement, where size, speed, and softness come together for a perfectly smooth and satisfying bowel movement. Easy to learn, lifetime to master. Okay, so the concept here is that we want to have a large, voluminous stool, large bowels, and we want to have them frequently and rapidly. We want to have rapid transit time, and we want the consistency to be soft. So we're going to talk about how to improve each one of these factors and what has been studied. First thing, stool weight, stool mass. They had done some population studies in the 90s and had related the size of the stool in terms of grams And they had correlated this with colon cancer rates or incidence per 100,000. There was basically an inverse relationship. Higher the stool weight, the lower the incidence of cancer. The fact that this has this nice sort of linear relationship, when you see something like this, you have to take notice. High stool weights of up to a half pound, 200 some grams, all the way up to 400 were very, very low on the incidence of cancer. Try to have large stools. What I'm telling you is that I want each one of you to be full of crap. That's what I said, full of crap. One of the things that's kind of interesting is when you go, if you had to go to the ER, for instance, or you had to get some sort of scan of your abdomen for some reason, some other reason, a lot of times the doctors will mention large stool burden. The patient is full of stool. And they think that you're constipated, but you're just vegan and you're eating a ton of fiber like you're supposed to, and you'll have a huge amount of stool in the system. And that's to be expected. If you have some other doctors that you run into and they mention that you're full of stool, say, thank you, I'm doing it right. But don't let them talk you into that it's a bad thing. Let's talk about soluble and insoluble fibers and what they do to the stool mass. So just like we saw an inverse and linear relationship between the stool size and the colon cancer rates, there is a linear relationship between how much fiber you eat and how large the mass of stool is. So the stool mass is made up of water and fiber, insoluble fibers, and bacteria. A large portion of the stool mass is made up of actual bacteria. The bacteria eat the soluble fibers, and the insoluble fibers, the stuff that doesn't dissolve or break down, can get plumped up with water and carry water with it throughout the stool transit. But when you compare bulking activity of soluble versus insoluble fibers, the insoluble, non-fermentable fibers do a little bit more for adding bulk. But that doesn't mean they're necessarily better. It's important to have both insoluble and soluble fiber. How can we gamify this? How can we make sure we're having large stools? I'm not suggesting that you actually poop on something and weigh it directly. I'm suggesting you could take the heavyweight poop challenge by simply going to the bathroom, weighing yourself before you go to the bathroom and afterwards, and switching it to grams, metric system on the scale. And the goal is the heavyweight challenge is to try to get a half pound or about 227 grams or more of stool per bowel movement. You might have to urinate first so you don't lose additional urine weight before you weigh yourself. So that's kind of one of the only little caveats on that. So that's kind of fun. As a vegan, you'll realize that your stool is very large, up in that half pound range normally. For the metrically challenged, it's almost 1 to 2 pairs worth of stool. If you're getting into mango-sized stool, boy, you're really doing well there. This was just kind of a way to compare size of things. Okay, we've talked about mass. Let's talk about fecal transit time. How fast is this going from the mouth to the rectum and out into the toilet? How fast are we talking about? Well, they had a way to measure this, and they would feed people radio opaque, things that would beads or BBs, things that would show up on the x-rays that wouldn't harm the patients, metallic pellets. In this study that was here in the early 80s, non-vegetarians averaged about 63 hours and vegetarians were averaging about 40 hours. So much faster stool time. So how would you test this yourself if you wanted to know? Well, you could eat some beets or you could do some other things. You could eat some high amount of quinoa, which much of it, or corn or things that would come out. I don't recommend eating blue dye number 5 or something like this that will come out. But that is another option. Sometimes when people eat like cake icing and stuff like that, it's pretty dramatic. But beets will color your stool red, and you could take note for the oral anal transit time. This was done by Burkitt. Burkitt is a famous doctor. They studied the stool transit times in this population that he studied. It was rural Africans and folks in a British boarding school. He put people into 3 groups. And so we've got the red triangles, the yellow, orange circles and the green circles. In the red, we had low residue, low fiber diets, people eating the British standard Western diet, I guess you could say, at that time, at the British boarding school. And then you had on the other extreme, you had high residue diet. So the African villagers who he was studying, and then you had African villagers who were attending the boarding school and had sort of a mixed diet. It played out when they did the study. It fell along very good curve there where the stool weight and the time to have a bowel movement was correlated. The folks that had very high stool mass had the quickest transit time. So you could see there where you can see almost 24 hours, they had high stool weights, like 360 grams, 420 grams. They were potentially having more than one bowel movement per day. You can see how this correlates. If you have a very small weight of your stool, it may take you 3-4 days to have a bowel movement. So that's transit time. Let's talk about consistency. Let's talk about softness and consistency. There is something called the Bristol stool scale. You know, the rabbit pellets type stool is very hard. Separate hard lumps suggest severe constipation. Probably an average American type stool is probably type 3, hard sausage with cracks, or maybe even lumpier, mild constipation type 2. Ideally, you're having, somewhere between a type 3 and type 4 stool, which is a nice soft serve stool, very easy to pass, maybe a little bit into type 5, but hopefully not runny stool, watery stool that's hard to hold on to. It's basically the biggest concern as it gets down low. But you needed some way to kind of describe stools for research studies. So this Bristol stool scale was invented. But let's talk about soft stool for the win. Soft stool for the win. So you want soft, large stools that are easy to pass. You don't want hard, lumpy rabbit pellet type stool, which is hard. It requires straining. They had a very, very interesting study here where they actually put things in the rectum. They put a silicone stool replica, basically a soft replica that was large of a stool that was easy to pass. It passed quickly and it passed with the least amount of rectal pressure. And then compare that with bags of beads, so small, lumpy beads or loose beads. And the loose beads were much, much harder to pass. This is something that you may hear from your doctor or may not, is the idea of the toothpaste tube analogy. With a toothpaste tube that's full is the analogy of a full rectum. If you take off the top of the toothpaste tube, very little pressure is needed to pass the stool or pass the toothpaste, basically. But at the very end of the toothpaste tube, you're really squeezing and smashing and pressing hard to get out a very little amount of stool. I really like this toothpaste tube analogy. It's another reason why we want to have enormous, large, soft stool. The goal should be to be able to have a bowel movement before you're able to urinate, quicker and more effortlessly than urination. Okay, let's add all this together. And when you compare omnivores, vegetarians, and vegans, in terms of the fiber grams, the frequency, the quickness of the transit, the weight, as you can see here, the more vegan or totally plant-based that someone gets, they're going to naturally consume more fiber, with a goal is about 50 grams or more. But see, they're getting 47 grams here in this study. The frequency, at least one per day was the average, but many times more than once per day. The mean transient time for this study was about 2 days, but it would be less. It was plus or minus there. The weight of the feces, about a half pound, 225 we talked about, and the softness, this was rheology is how they describe softness, but you could see it was the softest of the group. You saw that in that study, the vegans were getting about 47 grams, and the USDA recommends for men 36 grams, for women 28. But the goal actually would be even higher than that. We talked about insoluble fiber and soluble fiber. This is actually a very complicated subject. And the more I looked into this, the more my mind was completely blown, because you get these long chains these long chains for the insoluble ones, cellulose, hemicellulose, lignin. These are all about how the cell wall in plants are put together, the structural elements. And then you have the water-soluble elements. These are broken down into gels, gums, and mucilages, slimes and glues. So this is more of the sort of inside components of the plants and plant products that are a part of the structure and potentially even outside of the plant. Pectin are things like gels. The mucilages are things that are like real slimy and sticky, like okra and flax. There was not a good picture of the water-soluble ones because it's like pictures of like big gel and goop and stuff like that. When we're talking about soluble fibers, typically you think of insoluble fibers. When I imagine fiber, I think of like ropey, bran-like insoluble fiber, almost in my mind, almost like tiny bits of wood in a way, sawdust or something. But soluble fibers are different. Still, they resist the breakdown inside the small intestines, and they make it down into the large intestines where they're worked on by the bacteria in our gut, the microbiome. They become food for the microbiome, and the bacteria in our gut will produce these wonderful compounds called short-chain fatty acids. They get fermented. These also serve us in many ways because they are gel-like. They can hold on to the starches and create a little bit more slow digestion, slow absorption, and can bring down the glycemic index of foods that will result in decreased insulin spikes. So that is very important to know. So there's these soluble fibers, very health promoting. Remember I said that it's usually not all or nothing or one or the other. It's usually a mix of both because you can imagine the plant structural elements have the inside and outside structures of the cell of the plant. Here I've got it broken down into brown and green, and the green being the soluble fibers. So you can see here, apple actually has a lot of percentage of fiber being soluble fiber, but fruit, most of the fruit is about 50-50, really. This slide is a little busy, but the intent here is just to try to see kind of that breakdown. In all the plants, you're going to have kind of a percentage here. So the grains kind of lean in on insoluble fibers, and the beans have somewhat soluble fiber, especially white beans are leaning on the soluble fibers there. Some veggies have more soluble fibers than others. The big one here, you see the big green spike there on flax for soluble, and soluble you can kind of gel up. And we all know that we use flax for things like baking and like a vegan egg because you can see it kind of gel up. Soluble fibers versus insoluble fibers. I don't think it matters too much. When you eat a wide variety, you're going to get both of these. And you see that as soluble fibers help to control cholesterol because they cling on to the food in the small intestine and they help you pass it. And the insoluble fibers help to decrease colon cancer risk because they're increasing your bulk and this kind of thing, helps you feel full. There is an outlier, a third party. And the third party is this concept of resistant starch. Resistant starch. Not everybody knows about resistant starch. It's a little confusing, but basically there's 4 types of resistant starch. And if you imagine that the starch is a conglomeration of sugar molecules hooked together, they're complex carbohydrates. And they're not simple sugars. Simple sugars broken down. So the complex carbohydrates sometimes have a very complex formation, like a crystalline formation that's very hard to break down for the body. An example of this, everyone has kind of seen a food turn from sort of a resistant starch into a more simple sugar, the idea of a green banana. At first, it's almost like a potato, and then it switches over to a yellow banana with lots of brown spots. It's very sweet and very simple to digest. So you may have heard of this about the idea of potatoes. When you heat them up, if you let them cool down, they have more resistant starch. And the resistant starch, I want you to think about it very similar to the soluble fibers. It's starch that makes it into the small intestine, but doesn't get absorbed all the way. And so that once it makes it into the colon, it can be further broken down and fermented by the bacteria, food for the bacteria in the colon, the microbiome. Prebiotics, they're prebiotics, food that the bacteria want to eat, and they will turn it into healthful compounds, short chain fatty acids. More to come on resistant starch. This is something very near and dear to my heart, is the idea of the intestinal break. We all talk about the food noise. Doctor, I'm always hungry. I can't seem to break my craving. There's something going on here with the intestinal break, the ileal break, that we actually have a way of turning off the food noise. So the two factors here are these mechanical forces that happen in the stomach, the stretch receptors that tell our vagus nerve, the nerve that is the connection between the mind and gut, which is the vagus nerve. And it will tell the brain, hey, you're full, the stretch receptors. But there is another factor, and this is related to the nutrients. Pretend our body thinks that every meal that we eat is our last meal. And we want to get every ounce of nutrients out of the food that we eat. So once it makes it into the intestines, normally it starts being absorbed and being processed. If we eat food that is high on the glycemic index, readily absorbed, low particle size, pre-processed, easily absorbed into the bloodstream, not very many of those foods make it down to the very end of our bowels, of our small bowels, called the terminal ileum. In the terminal ileum, there's receptors that will see if there's food left on the table. Have we absorbed all these nutrients, or are there unabsorbed nutrients? These are things like high fibrous foods like beans and greens. And our body, even though it's gone through 25 feet of our small intestines, it hasn't been fully absorbed at the end. So the body sends out fullness signals because it wants to slow down the factory. It wants to slow down the assembly line so we can absorb more nutrients. A hormone is produced by our bowels called GLP-1. Analog medicines that look like GLP-1 are the medicines that are the most famous medicines out right now. The GLP-1 medicines are weight loss medicines and diabetic medicines because they make people feel full and lose weight, and they turn off the food noise. But you don't have to spend $1,500 a month for medicines like Ozempic and Mounjaro. You can simply eat diets that are very, very rich in fiber that make you feel very full and will cause your body to produce these GLP-1 agonists, these hormones, GLP-1, that will make your brain feel full and slow down your stomach and slow down the intestinal transit time. Let's talk about fiber supplements. Well, we talked a little bit about bran and insoluble fiber, but bran is when studied, bran has been kind of mixed. It does add bulk and increase the stool a little bit, but the big one, the number one by the American Gastroenterological Society is psyllium husk. Psyllium husk has both soluble and insoluble fiber, and it's the thing that's in Metamucil. This psyllium husk that you can buy, it's tasteless. But you put it in liquids and it plumps it up. It kind of gels them up. So you have to put it in a decent amount of liquid so that you can swallow it down. You can put it in applesauce. You can only pretty much do about 1 tablespoon per serving, per sitting, because it bulks up so much. When studied, this was for IBS patients. It helped to reduce their pain and their symptom scores dramatically compared to bran or compared to the placebo, which in this case was rice powder, white rice powder. If you're worried that you're not getting enough fiber, this is a supplement. And it's not a whole food because it's part of the psyllium grain, but it is both soluble and insoluble fiber. And it's as close as you can get to whole food as a supplement. But you don't have to do psyllium husk. You can do greens and beans and grains and get it from a whole food. Poop break number 2. Okay, we're going to take a break from the fiber and talk about what this image is right here. This image, if you don't know, is the first emoji for poop. The first emoji for poop. And what did it look like? It looked like a pile. It didn't look like a torpedo, like most American poop. So where was this poop emoji made? It was made in Japan, where plant predominant diets are more prominent than Western, a little bit more Western diets. And I joke around that if this emoji was made in America, of course, it probably looked like a torpedo, but not a pile. Let's talk about how my mind was blown based on fiber and learning about the microbiome. And I joked around that it was just the tip of the poop berg, because there's soluble fiber, insoluble fiber, resistant starch. And then there's the idea of eating a variety of plants so that you can present to the microbiome all different types of plants that can have various bacteria eat them and create a diverse microbiome. Basically, the more I learn about this and the more you learn about this, you realize you don't know poop about the microbiome because it's very confusing. There's hundreds and hundreds of different bacteria. It's very confusing. But what's quite interesting about this is that there is 10 times more microbes than human cells living in our body. It's quite impressive. Imagine the amount of enzymes that our body has to create chemical processes. And then when you compare that to the microbes that we have living in us, many more biological processes, ability to do amazing things to the food stream that you present to it. It has 150 more genes for various enzymes in the microbiome. If we take care of them, they will take care of us. The majority of our microbiome is in our colon, as opposed to mouth, skin, nose, and vagina. 60% of the stool mass is made of bacteria. It has a magical superpower of converting fiber into anti-inflammatory compounds called short-chain fatty acids. I'm starting to sound like a broken record about short-chain fatty acids, but we're going to talk about that more in a minute. One of the reasons why this has blown my mind, it has become a standard therapy for a killer disease called C. difficile colitis, where you actually transplant a stool transplant from one patient to another. So just like you can get a blood transfusion, you can get a transplant of feces, a fecal microbiota transplantation. This is now a standard therapy for C. difficile colitis, which is bacteria that is destroying the wall of the colon and is a deadly disease, usually brought on by severe and frequent use of antibiotics, where you'll have an overgrowth of C. difficile. Other very interesting things is about low diversity microbiomes are associated with illness. They're associated with obesity and autism, even schizophrenia and ulcerative colitis. One quite striking example of the microbiome and its power is the idea of pouchitis. Now, pouchitis is not something that most people learn about, but pouchitis is when you have a blind loop, your colon. Let's say you've had a gunshot wound into your abdomen and you had to have surgery. A lot of times what they'll do is they will take this dirty environment, they'll create an anastomosis. They'll tie part of the bowels to the wall of your abdomen and create a colostomy bag. And then they will have a blind pouch, an area of the rectum that doesn't have feces going through it. And this creates a blind pouch. And the reason why they do this is so that the inflammation and everything can cool down. And then at a later time, they'll reattach the bowels. But what happens is without fecal stream and without the microbiome in that blind pouch, the lining of the colon becomes inflamed and irritated. And that is because the fecal stream provides nutrients to the lining of the bowels, and it also provides anti-inflammatory short-chain fatty acids. The lining of the bowels uses it for their health. We know this is the case, and one of the treatments is actually for pouchitis is kind of stool washes and like a probiotic solution. So there is something called the enterotype. There have been studies here regarding the ratios. And these Prevotella are fiber-eating bacteria. And the Bacteroides were more fat-tolerant or bile-tolerant. What this tries to go and talk about is the idea of the microbiome that we have is related to what we eat. And the bacteria that thrive are the bacteria that we feed. And we want to feed our bacteria fiber. It's the food that the fiber-eating bacteria produce these short-chain fatty acids and provide the most protective effect for us, not the meat-eating or high-fat tolerant species of the microbiome. There have been health markers associated with higher Prevotella ratios. Here is just an example of Prevotella bacteria that ferment starch, that eat starch, like carbohydrates, that the more fiber that you eat, the more that the Prevotella will grow and thrive. Let's talk for a moment about the short-chain fatty acids. So short-chain fatty acids, if we're getting specific, what the heck is the short-chain fatty acids? We're talking about acetate. We're talking about propionate and butyrate. The one that gets all the press is butyrate. But these compounds literally feed the enterocytes, these cells along the colon. But they have more than that effect. They also get absorbed through the colonic membrane. This is a busy slide. I'm just going to read this out, that it does help to maintain the tight junctions between these colonocytes so that you don't have as much leaky gut going on, where you have a nice tight junction. They are anti-inflammatory in the bloodstream, and that they improve memory and decrease depression. It just blows my mind. Like I said, we don't know crap about this stuff. It's so important. It's so impressive that more and more we learn about it, the more it blows my mind. We talked about increasing fullness and increasing GLP-1 and fighting insulin resistance and making you feel more full. We talked about it decreasing inflammation. It's like fiber being an anti-asthma medicine. Come on. I mean, just seems very impressive that the more fiber you have, the less inflamed you are. And they're anti-cancer as well. Quite impressive. What I'm getting at here is that some good crap is what I'm telling you. That is very good crap. And it actually works in the opposite way. Just how I said that if the plant-based fibers are being eaten by and metabolized by Prevotella type microbiome, choline and animal products that come from meat and cheese and eggs get transformed to something called trimethylamine in the microbiome. In folks that are used to eating these types of foods, these people get used to transforming the choline into trimethylamine. And in the liver, this turns into trimethylamine oxide. And this is highly inflammatory to your vascular system. It works the other way too. If you're feeding the microbiome these foods that increase the trimethylamine oxide, then it's going to increase your vascular inflammation. What's very impressive is if long-term vegans who don't have high prevalence of this type of bacteria in their microbiome, if they happen to have, eat non-plant-based foods, animal products, when studied, these people did not raise TMAO because they didn't have it takes time to produce this type of bacteria in the microbiome. I'm not encouraging that. I'm just saying these microbiome effects, how they work. What about probiotics, prebiotics, fermented food? Come on, what is all this about? You've heard about probiotics because probiotics come in pills. I'm telling you right now, you don't need probiotics. Probiotics are expensive and they may have 1 billion colony-forming units in a capsule. And you say, wow, that's a lot. But 1 billion colony-forming units in your capsule is like a drop in a pool or a drop in a bucket, where there's so many bacteria living inside your colon that these are likely to not have a strong effect. What I worry most about is my patients spending money or taking time to take these pills, which might reduce the compliance for other medications or other things. So I don't recommend it. Well, then you have another group that says, well, what about fermented foods? You've heard doctors go online and talk about fermented foods like they're amazing. And there are small studies. That show that fermented foods can increase the diversity of the microbiome. And that may be true. I haven't seen where it's like becoming mainstream. There's probably more information to come about fermented foods. But what's interesting, when you compare probiotics versus fermented food wins out every time in terms of colony forming units that are going to be living in the kimchi and in the tempeh and miso, that you're going to have a higher colony forming count in this if it's a live food. If I was to say fermented food versus probiotics, fermented food wins every time. Prebiotics are fiber, the soluble fiber and the resistant starch that we talked about before. If someone comes at you with probiotics, tell them, don't worry, I'm eating all the prebiotics that I need. Microbiome, a big component, majority component is bacteria. What do a lot of Americans take on a regular basis for common colds and things like this is antibiotics, bacterial poison. You want to avoid it. Here is obesity mapped over the same map. You see the idea of antibiotic prescriptions and their prevalence. You can see a correlation. This type of data is, maybe there's other reasons, so this is not perfect data, but it does raise eyebrows. If you ask your doctor for stuff, a lot of times they'll give it to you. And because doctors want to help people, but if you talk to them about your cold and everything, you might walk away with an antibiotic. But watch out. Sinusitis is something that happens most times with most colds where you have sinus pressure and it will go away 7 to 10 days. You should start to have much improved sinus pressure, ear pressure. These things are not helped by antibiotics. UTIs become very common, especially as we get older. So I recommend patients would get UTI strips and can tell whether they're having a bladder irritation versus urinary tract infection, trying to limit the frequent use of antibiotics. We used to treat diverticulitis with antibiotics. You have the same outcomes with or without antibiotics. Otitis media, which is for ear infections in children. It used to be they were handing out antibiotics like candy, and nowadays we wait for significant 7 to 10 days usually. And a lot of times as the patient, you tend to want to take the longer course of antibiotics so that you don't have to go back to see the doctor. But you should ask the doctor, what is the shortest course? Because a lot of times in recommended dosing strategies, they'll say things like 5 to 7 days or 7 to 10 days. And ideally, if it says 7 to 10 days, stop at 7 days, as opposed to, you know what I'm saying. Foster a healthy microbiome by eating a diet rich in fiber. Increase the number of plants you eat. This is a way to gamify it. The 30 plants per week is where you can count, how many different plants that you've eaten to increase the diversity. Because just like out in nature, where they have different flowers and we have different animals or insects that will pollinate those flowers, you want to have a diverse microbiome to feed a diverse bacterial component in your GI tract. Avoid animal products. We know that they do things like increase the TMAO, which is inflammatory to your vasculature. Avoid chemical processing and chemical additives, overuse of antibiotics. And when possible, try to eat organic and avoid pesticides. Poop break, 3 or 4, poop break. Okay. Now, right here, there's a story. I believe it's a Martin Short movie where he talks about how he did a high colonic. He's like, oh, everybody's doing it. High colonic, do a high colonic and then poop out a candy bar you ate when you were 5. So that was what they talked about in the movie. But seriously, no need to do these high colonics because in the end, it's a one-way street. The fecal stream is a one-way street and you don't want to wash away bad bacteria. What you want to do is you want to starve out bad bacteria by eating a plant-based diet. Your fecal stream is what's feeding and growing the microbiome. In this part of the talk, talking about constipation and treatments for constipation and diarrhea and treatments for diarrhea. With constipation, we have to talk about the definition of constipation because among cultures and different countries, you have a very wide definition. And so they've developed this Rome criteria. And if people are not really bothered by it, they say it's not constipation. However, I would suggest that more people are probably constipated than not, especially eating modern diets. Lumpy hard stools, having to strain, feeling of not completely evacuating, having to do things like push on the perineum, digital maneuvers to kind of push out stool, feeling obstructed, or having less than 3 bowel movements a week is you have to have 2 of these criteria to be medically diagnosed with constipation. How do you avoid it? High fiber, that's pretty easy. If you are taking one of those fiber supplements like psyllium, make sure you drink enough water, because if you take like the psyllium or if you take like bran, you can actually have like insoluble fibers. This happens more frequently. You can actually have an insoluble fiber like brick that can form if you're not drinking enough water to make sure that that gets passed through. In general, if you're eating whole foods and high water content foods, that usually takes care of having to keep up with extra water drinking. Everyone has had this problem when they travel. When you travel, you leave your colon at home. It kind of seems that way. Why is that? Well, the fact that when you're moving around throughout a normal day, it helps peristalsis. And the organism, your body moving around, creates a little bit of aid to peristalsis. And when you're sedentary or immobile, you're going to have less peristalsis. Another thing that we do when we travel is that a lot of times we're withholding. Oh, I don't have time to poop right now. And so you kind of hold on to it. But then you end up with gas and abdominal pain, and you just don't feel good. You feel backed up throughout the day. We'll talk more about that. Sometimes you have to travel before your gastrocolic reflex kicks in. Now, this is your body making room by eliminating some stool. If you're eating, your body's reflex to increase peristalsis. You can have this function happen after meals. And so timing this to help evacuate your colon is a good idea. We talked about withholding. Position in the Squatty Potty. You can prime the pump. You can move stool. About 100 cc's, 100 milliliters of stool needs to make it down into the rectum for it to send the signal to your brain, oh my gosh, I have to have a bowel movement. You can do what I call a preemptive strike. If you are going to go on a traveling situation, you can do where you actually squat down with the pelvis down by the floor and your legs up, a squatting motion, and you can take deep breaths. And you can literally push some of your soft stool from the sigmoid colon down into the rectum. You can prime the pump. You can do a preemptive strike before you travel if you're not having an urge right away. Avoiding dairy. Dairy is evil. It really slows down the GI tract. And this is one of the reasons why millions of American children are constipated a lot of times is the dairy. Gas and bloating. I like to try to suggest that gas and bloating is oftentimes related to constipation. And that's because some methane gas that's produced by sitting stool actually can slow peristalsis. If you're feeling gas and bloating, it's time to try to evacuate. Try to induce a bowel movement with those position movements I talked about. There's a joke like gas is like, a stool honking its horn. The goal is to get it out of there. First thing you want to do is have a bowel movement. And are you still gassy and bloated? If so, add fiber supplements. Some fiber supplements actually can cause a little bit of gas and irritation and bloating. So you want to be careful. I really like the psyllium because it doesn't seem to do this. You'll hear about another one called inulin. I don't recommend inulin as soluble fiber because it causes too much gas and bloating. Some people, when they're starting a plant-based diet and they're increasing their fiber real dramatically, they'll have gas. And we'll talk about ways to reduce this through the cruciferous spectrum. Cut down, don't cut out. Don't remove all these plant foods from your diet or do a huge elimination diet. Just pre-digest them, cook them. We'll talk about ways. I'm not a huge fan of Beano and simethicone, Gas-X, just because it's extra things, but you can try these to see if they help you, kind of mixed results if people are experiencing these things, but they are tools to have. The Beano works against oligosaccharides. It's an enzyme to help digest oligosaccharides. Simethicone helps to break up gas particles. So here's something I call the cruciferous spectrum. Cruciferous has oligosaccharides, something called raffinose. that increases your gas a little bit because we don't have enzyme to digest it. But by cooking and processing the cruciferous, you're going to have less of the raffinose. More of the raffinose will get broken down. Cut down, don't cut out. If you can tolerate raw broccoli with stems, then you're a champ. You're a champion. But you may have to just tolerate florets or steamed, lightly steamed, or the concept is you have to move down the spectrum if you're finding that these plant foods are causing you too much distress, and eat small amounts of them and build up. Last couple things are about medicines and medical complications that cause constipation. We've all heard about how iron can constipate you and pain medicines constipate you, but also things like antihistamines that people take for allergies or allergic reactions. They slow down the GI tract. Even anti-blood pressure medications, calcium channel blockers, and diuretics either dehydrate you or actually slow the contractions of peristalsis, calcium channel blockers. Ibuprofen is kind of anti-GI, irritates the lining of the stomach, does lots of things. So NSAIDs, ibuprofen, you have to be very careful with them, very careful. And of course, there's anti-diarrhea medicine. If you're taking it for diarrhea, sometimes you can accidentally go over and totally block yourself up. There are some severe conditions that make it very difficult to have bowel movements, including thyroid disease, gastroparesis through diabetes, where basically the nerves around the GI tract become affected and you can have problems called gastroparesis. Everything slows down. Anorexia, if you're not eating somewhat in the food stream, you're not creating enough food stream, it can be problematic. Sometimes people have narrowed areas of the colon or the bowels and can slow down things. And there can be rheumatoid problems. Okay, here we go. Laxatives. Now, my favorite laxatives are prunes and psyllium, but you got to give prunes the A+. You got to give prunes A+ because they're a whole food. And you can do 6 prunes in the morning and 6 prunes at night. And not only does it have the osmotic or keeping water in the colon tract, it also has the bulk forming factor. So prunes are number 1, A+, with psyllium husk being the next, because psyllium husk has both soluble and insoluble fibers. If you've had a colonoscopy, you've also taken another osmotic laxative called Miralax or polyethylene glycol, which is a colorless, odorless powder that you can put in liquids. And if you drink 1 cup, it's like a laxative, or if you drink a gallon, it's like you can do a colonoscopy and clear out your intestines. I'm not a huge fan of magnesium type laxatives just because they're more medicine-like, milk of magnesia and all that. I'm not a huge fan of mineral oil. And I'm definitely not a huge fan of these stimulants because people can become addicted to stimulants. Many people are addicted to coffee and can't have a bowel movement without a coffee because a stimulant laxative. That can be a problem. There's zillion-dollar medicines called Linzess. So there are new medicines that help with this for irritable bowel syndrome related to constipation, but they're medications, and if your insurance company won't cover it, it's problematic. Docusate, if you've ever had a surgery, you've probably been given Docusate. This is like a mineral oil type, non-digestible oil, and I think it's kind of problematic. It just kind of changes the consistency of the stool and it ends up being sticky and I don't recommend it. Poop break number 4 of 4. Here we go. Poop break. Bidets are amazing. I wanted to highlight this here. Now, listen, this picture of a bidet is a fancy bidet, where you're having an actual one and an in-wall bidet there to the left. This is not what I'm talking about. I'm talking about it's 2023 and we have these bidet attachments. If you're vegan and you're pooping like a champ once, twice, maybe 3 times per day, you need a bidet. A bidet, you can get these $40 bidet attachments that you can get online, delivered right to your home the next day. And you attach it to the water that goes to the toilet. So no special plumbing devices needed. And you can shoot laser guided water to the rectum and clean it off. Really amazing. Everyone should have this in their life. It's a new world. Bidet attachments. Diarrhea. Last topic. Most that of us deal with this acute diarrhea. This is diarrhea that comes from, like a traveler's diarrhea, or a diarrhea that you get on the cruise ships, or a diarrhea that this Norwalk virus or noroviruses, these are so contagious, and they go through groups and families. You have loose stool for several days, and then it's done. And so this acute diarrhea mostly is from viral infections. And I try to give people expectation management about this. Most of the time, these are self-limited. They kind of go away. But meanwhile, you're miserable. Very hard to stop. There's nausea medicine. If you need, you can do things like loperamide or bismuth. Don't give bismuth to children because it has an aspirin component, a salicylate component. But you can use loperamide, Imodium, which can help stop you up. Traveler's diarrhea, sometimes erythromycin is now recommended, but in general, unless you're dealing with red flags like bloody diarrhea, it's usually not a problem. So, however, what I try to tell people to do with this is maintain your intake, because you can get dehydrated. You lose a lot of electrolytes through diarrhea. So there's something called the oral rehydration solution, very similar to what we think of as Pedialyte. It's a sugar and salt and potassium solution. You can get these oral rehydration packets, or you can mix it up in the kitchen sink here. You can do a watered down a sports drink and add salt. You've all seen the Gatorade-like drinks. They're too sugary, and so you have to water them down and add salt. But the World Health Organization has their own recipe, and they include sodium bicarbonate with baking soda and the salt substitute, potassium, as well as sugar. Now, the reason why there's sugar in these electrolytes is there's something called the sodium potassium ATPase pump. And basically, in order to absorb the water, you have to have the electrolytes in the water so they can be more easily absorbed. And so that's why you get better rehydration with the electrolyte solution with the sugar, as opposed to just pure water. They'll used to tell you, oh, don't eat, but that's not true. You can eat. You can eat with diarrhea, but you're going to want to eat a low-fat diet of rich in carbs, a high-carb, low-fat diet. It's a plant-based diet. It's what they recommend. It's just and so they call it the BRAT diet: bananas, rice, applesauce, toast. Enterocyte renewal, like a lot of shedding that happens during a viral event, and it takes a couple of days to kind of return to normal. And you start to replenish the biome with carbohydrate, prebiotics. So you can, as tolerated, veggie broths, low fat, high carb. You can slowly increase the sort of consistency and fiber to as tolerated. So, but chronic diarrhea is a problem. Basically, you need to see a doctor if you're having chronic diarrhea, because you have to get the diagnosis. You could be taking a medicine or a supplement that is causing you chronic diarrhea, something like metformin, which is anti-diabetic. Maybe you're on a long-term antibiotic regimen, vitamin C supplements or magnesium supplements. This is a laxative, and various medications. The red flags, though, is if you're over 50, or if you're having unintentional weight loss or rectal bleeding or nighttime loose stool. Very problematic. You want to get seen by a physician to help figure out what's going on. Remember, we want to treat the cause. There are medications, binding agents, cholestyramine that can slow things down. And we talked about loperamide as an over-the-counter Imodium. If people have visceral hypersensitivity, aka irritable bowel syndrome, the treatment, believe it or not, is fiber. Things like the psyllium husk and things like eating a whole food plant-based diet rich in soluble and insoluble fibers. This is very helpful as well for inflammatory bowel disease, specifically ulcerative colitis. There is microscopic colitis, which is a special type of colitis, which can be very hard to treat. And you need to be followed by gastroenterologists for this reason. There's other malabsorption syndromes. You all know about lactose intolerance, or you've heard about that. People feel bloated and have loose stool, but people could have gluten intolerance and this kind of thing. Pancreatic insufficiency can happen as we get older. The pancreas can not be producing the enzymes we need to fully digest. So these are things that you can get tested. People can have chronic diarrhea related to having their gallbladder out, and they have malabsorption of the fat and can cause loose stool. You have made it to the end of Scoop on your poop. And the takeaway is that listen to your bowels. What are they telling you about your lifestyle? We talked about the constipation and the traveling. Take the heavyweight challenge. Try to have a half pound of stool or 227 grams of soft stool every day that's easy to pass. Try to have BMs more than once per day and have big evacuations. It feels great. Foster a healthy microbiome by eating more than 30 plants a week. Expand your palate. Cut down. Do not cut them out. Don't cut everything out altogether. Increase the diversity. Once again, I'm Dr. Harrington. Get a doctor who gets you. I am a telemedicine provider, family doctor, does lifestyle medicine in 26 U.S. states, including Hawaii.
Thank you so much, Dr. Harrington, for sharing your valuable time with us today. Mahalo.
Mahalo. You're welcome. Hang in there. Nice to meet everyone.